Do you have blurred vision or double vision following a car accident or a head drop? About a couple of years ago, we had a gal that was watching a horse race and she was at the top of the bleachers and the guardrail wasn't there, and she accidentally fell backwards off the top of the bleachers and landed directly on the top of her head. For 2 years following, she had double vision, she had 5 migraines a week, cognitive problems, and of course neck pain. And she got into our office. Now we specialize in the upper cervical area, and what we do is called the Blair technique. It's a niche within chiropractic which focuses on C1 and C2, these top 2 vertebrae. And you may be asking, how the heck does that relate to double vision or blurred vision? Well, the joint surfaces, especially of the atlas, the top vertebra, right where your head sits, is the highest concentration of nerve endings in any joint in the body. And when a joint is moving the way that it's supposed to, it fires back into the cord, and the CNS and everything tends to work the way that it was designed to work. However, when you have a head drop or a whiplash and that segment dislodges under the neck and the joint gets locked and it doesn't move how it should, it sends aberrant signals into the CNS. And I could draw you a flow chart, which we might hear on TikTok someday soon, outlining when the upper neck is off and the joint surface is sending bad information to the CNS. It can affect just about any pathway in the body. It's called disafferentation theory. But anyway, many different chronic problems that people are dealing with following whiplash and head trauma type injuries are the root cause of them is the joints in the neck being misaligned from the injury and not moving how they should, impacting the cord and sending bad information into the CNS, causing disruptions. And at the end of that are all these different chronic issues that people are dealing with. If this video has touched you and you're dealing with these types of problems, we have an office in Sarasota, Florida. We offer a free consultation and exam. Come in, we'll run you through a battery of tests, go over your history, run a battery of tests to determine A, if you have an upper neck misalignment, and B, if you do, where. And then if the patient decides to go through with care, we take a 3D image, which is basically is called cone beam computed tomography. It's orthodontic technology they developed for implant surgery, but allows us to look at exactly what direction the joint has misaligned. These misalignments are 1 to 3 millimeters. Everybody's out of place differently. Everybody's joint angles are built differently. And the goal of the care is to get the segment back in position to restore normal motion and neurological function so you can do what you were intended to do, and that's function normally and be healthy.